This video is dedicated to Pima Medical Institute for guiding me through my journey as a respiratory therapy student, and to Memorial Herman Greater Heights for giving me the opportunity to capture and share the world of respiratory care. Every moment in this project was created with care and respect while being mindful of HIPAA to ensure patients' privacy. My goal is to show the dedication, passion, and impact of the respiratory therapy profession. Hi, welcome to the day in the life of a respiratory therapy student. Today I'm going to take you guys along with me for my evening shift, which is from 2 to 10 p.m. And let's see what happens behind the scenes. Let's go. Before I go see patients, I ensure I have all my essentials, my stats, pulse ox, notebook, and pen. I'm back in the respiratory department. I got assigned for 3 patients. 2 are vent patients and 1 is a BiPAP patient. So first we're just gonna look through the patient's chart, see doctor's orders, any treatments, their ABG values, interpret them, interpret chest x-ray, get all that notes, and then let's go ahead and treat the patient. Starting the day by grabbing meds and equipment to check patient's vitals. Here I am putting on my isolation gown because this patient is on droplet precaution. We do this to protect ourselves and others from respiratory droplets that can spread infection. So I'm about to give treatment with Duaneb and budesonide. Duaneb is a bronchodilator that helps open the airways, while budesonide is a steroid that reduces inflammation. And together it makes the patient easier to breathe. This is the next patient. I'm writing down their ventilator parameters. He is receiving an IPV or intrapulmonary percussion ventilation. This therapy uses more rapid burst of pressures to gently vibrate the lungs. At the same time, it delivers aerosol medication. Once we are out of the patient's room, we carefully discard the used isolation gown. This is the respiratory equipment room. We had to set up a BiPAP in one of the patient's rooms. These are the flow meters and TV to watch movies. This is a hyperbaric chamber which looks like a submarine. Patient breathes 100% oxygen at pressures higher than normal atmospheric pressure. It helps with increasing the amount of oxygen carried in the blood, promotes wound healing, and is used for conditions like carbon monoxide poisoning, decompression sickness, severe anemia, and sudden hearing loss. After every treatment, I make sure to chart what I did and how the patient responded. We document the type of therapy, the medicines given, vital signs before and after, breath sounds, patient tolerance, and parameters. On a ventilator patient, we make sure we reposition the tube, auscultate the chest, suction, and check the color, consistency, and amount of sputum. And then we write down the ventilator parameters and check alarms. Right now, I'm putting in the initial settings: respiratory rate at 15, tidal volume at 500, PEEP at 5, FiO2 of 100. Once the initial settings are done, we move to alarms. In mechanical ventilation, alarm settings play a critical role in ensuring patient safety and effective respiratory support. When weaning a patient, patients should pass a vital capacity of 10 to 15 ml per kg, NIF of minus 20 to 30 centimeters of H2O, inspiratory pause less than 30 centimeters of H2O, and expiratory pause to measure auto PEEP. Once the patient passes the weaning parameter, we move them to SBT mode and see how the patient is tolerating. If not, we'll put them back into SS control. And that wraps up my day. And that's how the day in the life goes for an RT. From treatments, vent cares to airway clearance and documents. RT school can be tough. There were times I thought I wouldn't make it, but clinicals showed me a whole different world and gave my work a real purpose. Being an RT isn't just a job, it's a chance to help patients breathe easier and make a difference in their lives. Thank you guys for watching.